This is Michaela Cagle on juvenile rheumatoid arthritis, more commonly known today as idiopathic arthritis. But in this video, I'll be referring to it as JRA. JRA is a disease of the joints in children, making joints difficult to move. It usually starts before the child is 16 and can last for a long time. The joints become swollen, making it hard and painful to move. JRA can lead to long-term damage of the joints and can interfere with growth and development. The picture to the right shows where JRA is most commonly seen in the wrist and knuckles, the knees, and the ankles. In this picture, you can see where the penis has started to form around the joints, causing destruction of cartilage. This can cause ankylosis, which causes the joints to merge together. There are 5 major types of JRA. The first is polyarticular JRA, which is when 4 or less joints are affected in the first 6 months. Second is polyarticular JRA, which is when 5 or more joints are affected in the first 6 months. Third, enthesitis-associated arthritis, which is swelling of tendons at the bone. Next, we have psoriatic arthritis, which is associated with the skin disease psoriasis. Lastly is systemic onset JRA, also known as Still's disease. This affects the entire body and is the least common type of JRA. Some of the symptoms that you will see in JRA is joint stiffness, especially in the morning or after long periods of rest, pain, swelling, tenderness or weakness in the joints, fever, weight loss, fatigue or irritability, swelling in the eye, swollen lymph nodes, and growth problems. Some of the growth problems that can be seen in JRA is growth that is too fast or too slow in one joint. This may look like an arm being bigger than the other. Secondly, joints may grow unevenly and overall growth may be slowed. Some of the causes of JRA is the immune system. The normal job of the immune system is to find and destroy things that shouldn't be in the body. With JRA, the immune system attacks the healthy tissue in the joint, which causes the penis, which eventually destroys the cartilage. Secondly, there are potential genetics that may affect JRA and environmental factors, but they haven't been proven yet. Our patient is Zuri Wilson, who is a 9th grade volleyball player. She has been experiencing pain and some swelling in her knees and ankles. Her mother and grandmother both experienced pain in their joints, but it wasn't until they were older. She sometimes has trouble getting around after sitting for long periods of time. When she first came into our office, we seen that she had some swelling in the knees. When we put pressure on her knees and ankles, there was some tenderness, but mostly in her knees. We also did an active range of motion test, which included leg extensions and ankle rotations. For her leg extensions, she could do them fully with little pain. Most of the pain was in her right knee. Her ankle rotations were limited with no pain, and they were very stiff. For her passive range of motion test, we also did leg extensions and ankle rotations. And her leg extensions were, again, full with little pain. And her ankle rotations were able to be done fully with little pain and still slightly stiff. We also did a CBC, also known as complete blood count test, which showed that her red blood cells were low. This is directly linked with anemia, which is common in people with JRA. From her range of motion exam and CBC test, we can conclude that Zuri has JRA. Our goals for Zuri is for her to continue playing volleyball. We also want Zuri to continue to build muscle around her knees and ankles to help support her joints and reduce stiffness in those joints. We also want to continue to increase her range of motion. These are 4 range of motion and strength exercises that I would suggest for Zuri. The first is hip and knee bends. Zuri should bring her knees to her chest, wrap her arms around, and hold for 10 seconds. Then she should repeat on her other leg and then repeat with both legs at the same time. This is a good stretch for Zuri's knees and the surrounding muscles. Second, we have ankle rotations. We want Zuri to complete 5 whole rotations, 2 times, 1 counterclockwise and 1 clockwise. This exercise helps with the range of motion in her ankle. Another suggestion to help with her range of motion in her ankles is to do the ABCs with her ankle once a day to encourage ankle rotations in all directions. Thirdly, we have leg extensions. Zuri should sit upright and her knees being at a 90-degree angle. Then she should lift her leg to 180 degrees and hold for 5 seconds. We want her to repeat this 15 times on each leg. This strengthens the quad muscles, which increases support in her knee joints. Lastly, we want her to do ankle flexions. We want Zuri to use a resistant band, push her foot towards the ground, hold for 5 seconds, and then repeat 15 times. This will strengthen her calf muscles that will help support her ankle joints. Sadly, there is no way to prevent JRA. My presentation, these are my references.